Hello, and welcome to this week's episode of I Came for Science, a show about sex and reproduction and inclusion in STEM. I'm your host, Laura Surratt. I'm a professor of biology, and I've been studying animal sex for the past 30 years. Please join me as we normalize talking about sex and what we know about it, as well as the journeys of the scientists who study it. I'm very pleased to have Joey Compton with us today. Joey is a forensic nursing program coordinator at Altman Hospital here in Ohio, and she's an expert in sexual assault evidence collection. She'll be following up on our episode that we had last season that was about clearing the sexual assault kit backlog. And in this episode, we really want to explore what is involved in collecting the evidence after sexual assaults. I wanted to start with two notes about this episode. The first is a trigger warning. This episode is about examinations that occur after sexual assaults. Most of the episode is about what happens during the examinations and what resources are available to victims of sexual assault, but issues related to the sexual assault itself are also discussed. The second is an audio warning, which is that we had some audio difficulties, and so there's times during the episode where some of the audio fades out. But please stick with us because it's good material and we'd like you to hear it. So welcome, Joey.
Thank you, Laura. Thank you so much for having me. I'm excited to give a little more insight about what happens during a sexual assault exam and what patients can expect, and then how community members can help improve seeking care and responses to disclosure.
Great. This is so important. I'm so glad to be able to share this with our audience. So I want to start by just finding out, what does a sexual assault nurse examiner do?
So a sexual assault nurse examiner is a specially trained nurse that takes care of patients that disclose sexual assault. So typically, if a patient is coming into a healthcare setting and seeking care for a sexual assault, they will care for those patients and give them options regarding evidence collection, photography of injuries, those types of things. It varies a little bit based on where the patient is in the healthcare system. And if there is an extensive program at that healthcare center, or if they are being cared for by someone who has a less amount of training. So it's a real complex concept. We at Altman have a program, a forensic nursing program. So there is this trend to change the title from sexual assault nurse examiner to a forensic nurse. They are essentially very similar, and we still are sexual assault nurse examiners and receive that training, but we're really expanding on that role. So we're changing that title a little bit to forensic nurse because we are caring for patients who disclose violence or experience violence that is not just limited to sexual assault. So again, with the Altman program, we can come in and take care of patients who've experienced domestic violence, interpersonal violence, human trafficking, if they're disclosing non-fatal strangulation, elder abuse, child abuse, those types of victimizations. Some programs will also come in and serve patients who have experienced physical assault or other victimization. It really kind of varies based on the extent of the program in that hospital system. So it's a lot. We interact with patients, and we're a benefit to the healthcare system because we have received a minimum of 40 hours of training. And that's just kind of the introduction to becoming a forensic nurse or sexual assault nurse examiner. And then it expands on that. So you learn in that 40-hour training kind of the basics of how to collect evidence, techniques for using that, exposure to what happens with sexual assault, some of the emotional dynamics and implications for healthcare, short-term and long-term. And then you expand on that with clinical education, observing cases, doing simulation. We will then also work with a peer group to make sure that you are ready to provide that care to the patient, and do so in a comprehensive way. Then you start seeing patients on your own. And then, of course, there's, just like any other healthcare field, ongoing education and training and other things that kind of go into maintaining that competency.
Wow, that is a lot of training. That's amazing. Is that all on top of already being certified as a nurse?
Correct. Most forensic nurses are registered nurses. There are some that have advanced training, or they may be a physician assistant, a nurse practitioner. A physician can also work as kind of a forensic medical care individual, or may work in those forensic nursing programs, or provide care. So So in our program, we have registered nurses, and we do have a couple nurses that work with us in the capacity of a registered nurse, but they are a nurse practitioner trained as well, but they're not functioning in that role when they're working with the Serenity program. So what we find is that a lot of times people who are excelling in this role and have that education and empathy and passion to serve this patient population, that they oftentimes will go on for advanced training in maybe women's health or in an emergency room setting, because that naturally flows with their passion for caring for others, if that makes sense.
It does make sense. Yeah. I have two questions. So the Serenity program, that's the name of the Altman program. Sorry.
Correct. That is
Okay.
the name of Altman's forensic nursing program.
Okay.
We are called Serenity.
That's all really reassuring. I think I didn't really understand that the people doing those exams had such extensive extra training on top of the training you receive as a nurse. I was wondering what led you to become a nurse examiner and specifically to be involved in sexual assault evidence collection.
Yeah, so my background is in the emergency department. So before I was a nurse, I was a 911 dispatcher and worked in the business world, and eventually ended up in nursing. And my passion was in the emergency department. That's where I had my background. And so I was introduced to caring for this patient population as part of that role. So if a person presents to a healthcare facility that does not have a specific forensic nursing program, typically they're seen in the emergency department setting, and an emergency department nurse will do the exam, collect evidence, provide them care. So I was introduced to it through my role as an emergency department nurse, and I got the initial training, which was a couple hours, started helping take care of these patients, and really kind of grew this passion for making a difference. I felt like I could impact people in a way of empowering them back to make decisions, providing them with information and choices. And it sort of just snowballed from there for me. I kind of found that I have this talent, as silly as it sounds, to have this ability to have uncomfortable topics and discuss those in conversation. So
Wow.
I enjoy that. I like talking to other people about it, hence this podcast, although it's a first for me.
Thank you.
A lot of presentations within the community about what does sexual assault, domestic violence patients experience, what are they going through, how can we kind of improve our care for them as a community and the culture that they're experiencing when they disclose.
I'm so glad you're doing this. Thank you. I was wondering if somebody wanted to go into this field that you're in, if you have any advice.
If you know that you want to go into this role, getting that sexual assault nurse examiner initial 40-hour training is a good first step. Connecting to a local program and asking them if they're hiring or what their orientation onboarding looks like. And if you can do any of those steps before having an official position, those are always good things. And then just networking with people who do this work to figure out kind of like your best way into that. This can be heavy work. You're dealing with a lot of sad, traumatic situations, and we are at risk for that secondary trauma or secondary stress related to that work. So making sure that you're processing that, you're recognizing your own self, that you are doing that self-care, and that you have some sort of person, whether that's a mentor or a supervisor or your own individual work or personal counselor, that you're processing some things. So to make sure that you're not holding on to that stress, I would also encourage people to look up and know the signs and symptoms of secondary stress that you may be taking home from your work. And that could apply whether you're a forensic nurse or a social worker. I mean, really
Right.
anyone who's
Anyone.
feeling
Yeah.
trauma, right?
Yeah.
And just knowing it so that you can recognize those in yourself and that you can prevent them and improve your resiliency in order to continue working in that field.
One thing that I know you really wanted to share with our audience is what an exam is like. What should people expect when they come in for an exam? What's that procedure?
Yeah, so I think that there's a couple things that go with that. First, I think that a lot of times people underestimate the invasiveness of it, and not from the perspective of the patient. We don't want them to feel intimidated that it's invasive or be scared and not want to do it, but we also want to be realistic with them, right? So we want them to sort of understand some of the whys behind what we might be doing or why we might be asking certain questions. But we also want to make sure that the community is aware that it is not an easy thing for someone to undertake this type of exam. We're asking a lot of really personal questions and a lot of very specific details about something that happened to them. And those are not easy things for someone to discuss. There's a lot of physical and emotional trauma that goes with experiencing violence. And then we're asking that person to relive that and
Mhm.
give us potentially very specific details. So that's kind of the first thing, just making sure that the community knows this is not simple. This is not easy. And patients can go, not everyone, but patients can go through distress. And it takes a lot of courage to disclose and discuss and come and seek medical care. So it's kind of the first part
Yeah,
that's important for me. The second part is just knowing that a patient knows that it is absolutely important for them to consider needing a medical evaluation. Again, every situation is a little bit different. So I'll kind of try to give some generics about what
sure.
we do with the exam, but it does get tailored to what the patient needs and what applies to their situation. But we want them to know that we do care about them. We want to make connections for them to local resources. We want to get them the medical care they need and give them all the information. And we also acknowledge that can be a little overwhelming and scary. So hopefully, if we can tell them what to expect, it will make a difference for them seeking care. The first thing I would say is if someone has experienced any sort of violence, domestic violence, sexual assault, all those things that we've been talking about, is just know that there are people who do want to help you and who will believe you. I would encourage anyone in the community to know, because any of us can be victimized or have someone disclose to us. So knowing the resources available and the programs in your area, where is your local healthcare facility that has a forensic nursing program where these individuals are going to get the best level of care, right? So we talk a lot about going to an appropriate healthcare facility. And sometimes that means maybe going outside of where you would normally go. So certainly your primary care doctor can help you. And if you're comfortable with that relationship, that may be a great place for you to disclose. There's no right or wrong answer, but just being aware that a lot of times primary care doctors' offices are not necessarily equipped to fully collect evidence or document a situation, because that's not really their primary role, right? That's not what most people are going there for. So finding out where in your community can serve you best with a forensic nursing program where you can get comprehensive care and connection to resources will be kind of your first step in getting the best care possible. The next step is just to understand that there are going to be some things, because we're in a medical facility, that you're going to have to give a name and a date of birth and be registered. A lot of times the forensic nursing programs are kind of a consult. So you're checking in to the facility in some capacity, and then they're coming in to take care of you. So
Can I ask you
the
a
other
quick question there? Do you have to have insurance?
you do not have to have insurance. So they will ask you again. I can speak mostly for what our healthcare facility does, but they're all very similar for the most part. There'll be some exceptions. So when you come in, because you're registering as a patient, you're going to have a request for who is your insurance provider, who's your primary care doctor, and some of those registration processes. If it's a complex thing, you do not have to have insurance. If you receive care that will be billed to you, you can be a self-pay. And there are certain portions of a sexual assault exam that are not billable to the patient. So we'll kind of come back to that in just a
Okay.
second if you're okay with that.
Yeah, that's totally fine. Yeah.
We'll kind of re-go over the billing thing. So when a person presents, the forensic nurse and specifically our Serenity team, we come in, we talk to the patient, we document with them what happened with that violent incident or sexual assault, kind of getting when did this happen? Did you know this person? And it's okay if you did or didn't. We're just, again, trying to gather some of that information and document. We ask some screening questions. Some of those relate to safety. Some of those relate to other violence that may have been encountered. And what we're really looking for is injuries that the patient may or may not be feeling pain from yet, or may not realize that they had an exposure. So we're asking, again, some of those details and screening questions. We offer to the patient to do kind of a head to toe assessment, just looking over from head to toe. Do we see any injuries? Are there things, symptoms, pain, those types of things that they're experiencing since this violent incident? We document those injuries, and then we discuss with them available and recommended medical treatments or exposures based on what their situation was. So again, in that example of sexual assault, we would discuss with them based on who the individual was that assaulted them. Is there an exposure to sexually transmitted infections? Do you know this person? Is there a risk of pregnancy? And all that kind of goes based on the incident details, the patient's history, medications they're on, and then who the perpetrator is in regards to them, if that makes sense. And so we walk them through talking about those things. What are the risk factors and implications? If they have risk factors of exposures, we talk to them about medications that can be given to them or prescribed to them that would prevent them from contracting a sexually transmitted infection, or preventing pregnancy if that is a risk. Or we will talk about, hey, you have an injury to this particular area, an x-ray might be recommended, or those types of things. So again, it's kind of hard to give specifics when everything is so much guided on the specifics of that exam.
Right. Each case is different.
Right.
Right.
Absolutely. And we talk to them about if they want us to photograph any of those injuries, if they want us to collect evidence of the sexual assault. So evidence can include swabs that look kind of like Q-tips,
Mhm.
and swab areas where the patient may have experienced contact. So if there was, and again, this will be a little dependent on the type of incident, but if there was kissing or licking or sexual contact
Mhm.
to the neck or to the genital area, we can collect swabs of different areas, underneath the fingernails, inside the mouth, those types of things.
So let me just ask, it sounds like from what you said that the victim can make a choice at every step of the
Yep.
process, whether they want to do it or not. Is that right?
Absolutely.
Okay.
So 100%, we talk through different options based on what they've disclosed or experienced. And then we say, hey, we have the option of doing this. What do you want? What do you want? How do you feel about that? And we try to make sure that they're making an informed decision. We want to tell them kind of I hate to simplify it in pros and cons, but this is what, if you don't have evidence collected, could be a consideration or reason you might consider it. And here's a reason you might not want to consider it. And we base that on what the patient might have shared with us. So some people will say, I don't ever want to speak to police. I just want to know if medically I'm okay. I don't want to ever press charges or deal with law enforcement. I have, some sort of triggering situation from law enforcement. And so we'll
Mhm.
walk through, if you have evidence collected, at some point, it will be turned over to law enforcement. We kind of walk through what is best for that patient. There's no right or wrong answer. It's really their situation. And if they're unsure, again, we try to give them information to help them make that decision.
Wow.
We also have some options if they don't want their name on it. In the state of Ohio, they can have things collected anonymously where there's an assigned number to it and not their name on that evidence collection kit. So those can be options too, and will vary based on certain situations. So again, for example, anyone under the age of 18 cannot have an anonymous evidence collection kit completed. They have to have their name on it. If they're over the age of 18, then typically they can decide if they want their name on it or not. So we really walk them through. I know I've kind of kept saying this, but it's just such an important thing. We walk them through what the options are, what we can help them with, what medical short-term and long-term implications there are, and then we let them make those decisions. Because really, we know that they know their situation the best. We know what's going to be best for them, safety-wise, care-wise. Can they even swallow pills, or do we need to come up with a new alternative for that? And so we
Mhm.
really customize it to each person's needs.
That's great. And it's so important at that point in their journey for them to feel empowered in that process. Yeah.
Absolutely. And then
Yeah.
we kind of go through discussing safety planning and connection to community resources, talking to them about what they can potentially expect for next steps. How do we do, making sure that they're safe. And then we wrap up usually, or midway through, we're discussing some of those reporting options. So whether they want to speak to police or not, whether they want to provide information or report, but then not further that conversation. So there's a lot of different options that could overwhelm us and be a whole nother podcast. But just
Right.
knowing that they have choices,
Mhm.
and they can say, I want to do this part of the exam, but not this portion. It's not an all or nothing. It's an ongoing consent. And we know consent everything, and you have to consent to each conversation verbally to us. And we're always rechecking in with you. Are you sure you're still okay with this? Do you need to take a break? That's kind of thing. That definitely leads us to being there for a couple hours. It depends on, again, the extent of injuries, but the average can last a couple hours. So that's
Okay.
another piece of information that we want to make sure the community knows and patients know, is that you will be there for probably a couple hours. So we will try to meet your needs if you have to make arrangements to pick up a child, or but we want to keep that in mind for them, that you are going to probably be there for a couple hours talking with us. So I just kind of wanted to go back and revisit the billing
Oh,
situation.
right. Hmm.
So certainly you can seek medical care anytime you have a concern for medical or exposure related to a sexual assault. Specifically, there are some time frames that go with the actual evidence collection. So if there's an understanding that as a person you were sexually assaulted, and you want to have the evidence collection kit completed, that happens within 96 hours of the assault. So if someone is sexually assaulted, they have 96 hours in that window for adolescents and adults to collect evidence. So if you want the swabs completed, that doesn't mean I discourage you from seeking care or disclosing after that 96-hour window, but just some general timeframes. A child advocacy center or pediatric, their timeframes are a little bit different. They will collect evidence for either 72 or 96 hours, depending on the circumstance and the age of the child. So adolescent and adult, which is 13 and older, is up to 96 hours we can collect evidence. The other consideration is sometimes people are concerned about billing, right? So if they don't have insurance, or if they're fearful of their insurance being billed, in the state of Ohio specifically, if you have evidence collection completed, you cannot receive a bill for that evidence collection or the preventative antibiotics for sexually transmitted infections that you are given as a result of seeking treatment with evidence collection. So that bill is covered by the state, and so you should not receive a bill. So again, that's another reason why we encourage patients and individuals to seek care where there's an established program, because then there's a process in place for ensuring that the billing is handled correctly. If you're going to somewhere else, say a doctor's office or a hospital system that doesn't have a program, something could slip through the cracks for just lack of the systems being in place. Does that kind of make sense? It's not
Yes.
necessarily
Yes.
intentional, but just they could receive more of a bill. I will clarify that some portions are billable. Like if you have an x-ray or you have a CT of your head done, then you could have that portion billed to your insurance. So it's a little bit complex. I don't want to oversimplify for the podcast, but I do want to make sure that we acknowledge there is the potential that you would not receive a bill if you're having evidence collection. And then forensic nurse should be able to give you some information about what would be billable or not. And there are programs through hospital systems and through the state to help you get reimbursed and compensated for any bills that you would have to pay. Definitely don't let that be a huge barrier, which is easier said than done, obviously. But
Right.
I know that we will try to help you and connect you to programs to offset that bill so that there isn't that additional financial burden.
That's great. And we can link those resources to this episode for people. And do people make an appointment to get an exam? Is that how it works?
So that's kind of a difficult question. So with us in the Serenity program, they don't necessarily make an appointment. They present to any of the locations that we serve, which is Altman's main campus, the freestanding emergency department in Massillon, Altman West, and the Altman Orville Hospital. So they just present to the emergency department or disclose if they're an inpatient, and then we're called. You don't necessarily make an appointment. Systems, if they have a sort of what we would call a family justice center or an adult or child advocacy center, they may have a scheduled appointment. So for pediatric exams, the Wayne County Child Advocacy Center will schedule appointments to do those exams, and theirs look a little bit different. The pediatric population, especially those under 13, can look a little bit different, but those are oftentimes scheduled in advance. So some places, some people don't. At Serenity, we're having some potential future where we might be able to work with someone if they've reached out to us to schedule an exam if, again, there's a safety component there. I can't go for 3 hours right now, but can I come in tomorrow morning? Or, you know
Right.
what I mean?
Yeah.
And where they may not have childcare right now, or it may not be safe for them to leave a domestic violence situation at that moment. And so we're kind of exploring some of those options, but typically there's appointment needed.
And who else is in the room during the exam? Is it just the nurse and the person who came in?
It again is all up to what the patient wants.
Mhm.
So the nurse will be in there, patient will be in there, and then they can have a support person of their choosing. So if they wanted to bring their friend, their family member, their significant other with them, and then we also will offer them to local advocates. So, for example, in Wayne County, we call in 180, which is the advocacy group there, and they'll come in and be a support person for that patient, and they can be involved in as little or as much as the patient wants, but they're there to provide additional information, to be someone just to support them, to help advocate for them if they don't want something or do want something. And then those individuals are very knowledgeable in helping with protection orders, or advocates can go patients in the future to help represent them if they had to testify in court, or if they had to be involved in filling out legal documents regarding what's going on with this situation. And then they also them to counseling options, peer support, shelter. There's lots of things that advocates do that, again, could be a whole other podcast, but we
Yeah.
do of an advocate being there for that person, and then they decide if they want the advocate to stay or go. So it really is totally up to the patient. And I've had everything from them wanting to be alone to them having a full support people in the room.
And in what cases would there be a police officer or an investigator from like a sheriff's office or something there with them?
So we typically, and again, this varies a little bit when you're doing a child ad center or adult advocacy center. Law enforcement might be a bit from another room in some of those settings, but for the majority of the hospital-based forensic programs like Serenity, we don't want law enforcement to be in the room while we're doing this exam. We're doing a healthcare exam. We are talking about details that they may or may not be comfortable sharing with law enforcement, and that's their choice if they want to share that information. Really, for us, we want to make sure that they're giving us a full picture of where they could have injuries that would need medical treatment, or exposures that would need that healthcare follow-up. So we want to make sure that they're not feeling in a position where they couldn't be fully honest disclosing that for fear of judgment, or just the fact that they don't want to discuss their healthcare and what medications they take in front of her. You know what I mean? That's a little
Right.
bit of relationship.
Mhm.
What we will do is be willing to help the patient report. If they decide they want to report, then we'll say, would you like me to organize this for you, or kind of give a summary to law enforcement, or give them what we would call the narrative of what you shared with me. So details of kind of, I was here, this happened, there was this types of contact, and then this is how I got to the hospital, kind of timeline or scenario. And if they say yes, then we can help facilitate so that they don't have to repeat the entire situation again. Does that make sense? The
Yes,
goal,
absolutely.
we
Yeah.
can help summarize some of that information along. It saves the patient from having to tell their experience over and over and over again. Law enforcement will want to, if law enforcement's involved, they will get a statement of some kind from the patient as well, but that could even arranged a couple days later, or different techniques depending on the department.
This is such important information. I'm so glad you're sharing it, Joey. And I think it would do a lot to ease my mind if I was in that situation, to just know what the scenario was like, what was going to happen. But I was wondering if there's some people in our audience who would be either themselves or know somebody who's anxious about getting exams or after an attack or abuse. Is there anything you would want them to know?
Yeah, so I just think knowing that there's no simple one fix for each individual, but some of the barriers that we hear patient for not seeking medical care or not disclosing are really that fear of not being believed. We hear barriers to seeking care about that shame or self blame, and those victim blaming statements. And I just want them to know that, again, knowing those forensic nursing programs is going to really help. If you're presenting to a place that has forensic nurses to care and complete these exams, we're going to be reassuring you throughout the thing that we do believe you, that we know it took courage, and that it's really difficult to talk about this, and that for some people it's more difficult than others, and to know that we are going to take our time with you, that we're going to allow you to take breaks. We're not going to force you to make any decisions. We're going to know that everyone experiences and reacts to a traumatic situation like sexual assault or violence in a different way. We know that there are patients who will fight back. We know that there are patients who will, what we call that freeze mechanism or chronic immobility, where they just, quite frankly, for lack of a better word, freeze, disassociate. It's almost like they're having an out of body experience where they don't necessarily fight back or run away. It just happens. And that's a normal response to trauma. That is a situation where your brain has subconsciously decided that your best chances of survival are kind of to freeze, to take no movement or no specific action, and that's increasing your chances of survival. And I think for a lot of patients, they don't necessarily understand that that's a normal response. And then when they disclose to others, people say, oh, well, why didn't you push them off? Or, well, why didn't you run away? That's what we would call a victim blaming statement. That is not something that everyone does. And I think, again, we don't know how we're going to react in a situation until we've lived it. And everybody reacts differently. How we think we will react may or may not be the case. And so I think that just, again, knowing we're going to be emotionally and physically supportive of you, we're going to discuss those options, empower you to make all the decisions, kind of give you information that you may or may not be aware of. We're going to help connect you to those community resources. But first and foremost, we're going to acknowledge that this is difficult and that you're going to probably have some ups and downs, and you may be tearful, you may not be tearful, you may want people in the room, you may not want people, and all of those things are okay, because we know everybody is going to experience this differently.
You had mentioned what other people might say or think, and I want to just pick up on that theme. So if you're someone who is confided in by someone who's been a victim of assault or abuse, do you have any recommendations for what someone could do in that situation to be supportive of the person who's been victimized?
Absolutely. So we do know that a lot of times individuals will disclose to what we would call kind of an informal person or a support person, someone who is not necessarily what we would call a formal person. So a formal person would be a healthcare worker, law enforcement, a counselor, that type of thing. Those informal disclosures or peer supports would be a family member, a friend, a significant other, individuals like that. And we know that regardless of who they disclose to, it's so important that the impact of how that response comes, if they are saying things like, I'm sorry this happened to you, it took courage to disclose that, how can I help you? Just even sometimes, again, in an appropriate setting, depends on who you are to this person, but just hugging them or saying, I'm so sorry this happened, and acknowledging that courage and that this is a terrible situation is kind of a great first step. Again, it depends on how you know this person and the type of relationship and the personality of the person who was victimized. But, you really usually can't go wrong with, I'm so sorry that happened. You know what I mean? Those types of things.
Yeah, that's all such good advice. I think in the moment, some of us aren't aware enough to have, quote unquote, the right response, right? And so I would encourage our listeners, even if you feel like your first response wasn't as supportive as it could have been, circle back around and do some correcting and some supporting, because sometimes we don't, in the shock of the moment, respond exactly in our best way.
Absolutely. And sometimes even just acknowledging that and taking ownership of, like, I don't know why I just said that. Let me back up. You know what I
Back
mean?
up.
Because
Let me have a do-over.
yeah, let me have a do-over. That didn't come out right. That's not what I meant. So I think just
Yes.
treating people, with empathy and respect, which is a very intentional act. It doesn't necessarily just come naturally. You really have to make sure you're being purposeful in how you're responding to people.
Yeah. And I bet that the relationship of the two people really plays a role in how the person who's being disclosed to responds. Like I can imagine if you're a parent hearing that a child of yours, no matter what age, was sexually assaulted or the victim of abuse, that you might start getting caught up in your head, like, what did I do wrong? How did I, like, making it about you rather than about them, really, too.
And I think too, sometimes even when we are disclosed to, no matter who is disclosing to you, whether it's in your work role or your personal life, and just knowing that you could be making an impact and trying to, pause, have a brief moment, gather your thoughts, and then listening to podcasts like this and educating yourself and just even having those difficult conversations, because we don't know what we don't know, right? And I'm
Right.
not trying to anyone who's ever had that reaction. If you've never really thought through or had that education or a conversation like this, you wouldn't know. It doesn't mean you're intentionally trying to hurt that person or victim blame, but it's just, again, how it's perceived. And that goes for healthcare workers listening to this as well. Just how are you reacting to disclosures? Are you asking the right questions? Are you giving them options and not judging them, or making sure that you're meeting people where they're at?
Good. Well, thank you so much for joining us on I Came for Science. I really appreciate everything you're doing and everything you shared with us.
Yeah, thank you for having me. And if anybody has any questions, you can get them in contact with me and I can try to clarify anything. And again, sometimes it's a little overwhelming to speak in some of those,
Yes.
but hopefully we got them at least the introduction to what to expect.
Yeah. Finally, I'd like to thank you all for listening to this episode and thank our production team, Natalia Ryusik, Isabella Espinoza, Sam Carmel, Pras Subadi, and Lane Patton. The music for this episode is entitled I Don't Smoke by the Mythical Score Society.